Hello Gero504, I'm Sarah Bentley and I have just completed some research on the future role of home and community-based services, and I'd like to present some findings and observations to you this afternoon. From now on, I'm going to refer to home and community-based services as HCBS. The future role of HCBS presents a challenge and an opportunity. It's been said that leadership is honed in the crucible of challenge, and it's going to take innovative leadership in order to effectively shape the future of HCBS. And we can be a part of that. The growing demographic of older adults is not the first to desire aging in place. Florence Nightingale, who's often recognized as the founder of nursing, saw the need for home visits. However, with an increasing number of people over the age of 65, a shortage of workers in many parts of the country, and countless questions about funding, we are presented with a great challenge. For people of means, private pay in-home care is possible. Medicare and Medicaid, which often varies from state to state, can and does provide funding for HCBS. The regulations can often be very confusing, and sometimes many people could qualify but may have to find an expert to help navigate the system. At the same time, there are those at or below the poverty level with little recourse. Now and into the future, funding options for HCBS have to be simplified and effectively communicated. It will be necessary for people to understand their options and pursue the appropriate funding streams. Observing this graph will show us the effective use of HCBS can be cost-effective and contributes to a better quality of life. It's hard to imagine such a difference in costs associated with care, yet the graph clearly shows us the data from the National Council of Aging in Place. You can see that nursing home costs are 3 times the cost of care at home. The government likes this. Medicaid and Medicare fund HCBS based on the research. It's safe to assume that aging in place makes sense for many reasons. Research and experience consistently tells us the key components of aging well are mental stimulation, physical activity, and socialization. And these can all be effectively implemented through home and community-based services. The late, great Peter Drucker said, "If you want to predict the future, you must create it." It's important for us in the field of gerontology to be creative about the future of home and community-based services. The issues are many and varied, and they include access, funding, caregivers, and regulations. So what are some of the creative possibilities? Technology can assist us for the future of HCBS. Information technology and robotics will have an impact with care at home and helping to keep the client healthy and well and safe 24 hours a day. Ideally, we should be creative about how to include and expand parish nursing services. And I think we must also expand involvement with all faith communities and social service entities. Co-housing opportunities, as well as engaging with family and friends, can be an important part of HCBS. Ron Heifertz wrote in The Practice of Adaptive Leadership, "What can we learn from our history that can help us to be innovative into the future?" So what can we learn from Florence Nightingale? What can we learn from social services? What can we learn from government entities? What can we learn from parish nursing? And what can we learn from faith-based communities? I believe the future is really bright for home and community-based services. It's a win-win situation for the well-being and good health outcomes for the older adult, and for the sources of funding. How we respond to an increasing number in our population who want to age in place is imperative for creating the future. Thank you.